Welcome to this session, and I would like to start the session right away. So if you guys have any question, first of all, I would like you to confirm if my voice is clear and audible.
Yes.
Okay, thank you. So if you guys have any question prior to the session, you can ask me. Otherwise, then we can start the session. You can start practicing it. Okay, so it seems like nobody has any question. So I would like two persons who can perform a role play. One will be doctor, other will be the patient, and then you can switch your positions as well. So who would be willing to perform first? Who would like to perform first? Can I have two persons, please? It's really important for everyone to perform because that is how we can figure out what mistakes you guys make, and that will also give you some confidence. Yeah, you can act as a doctor. There is a person who messaged. You can act as a doctor, and then you can switch your positions as well for the other person. Once you act, then you will be the patient in the second one. So who would like to perform with her? Can we have another person? It's really important, as I mentioned earlier, we all need to perform because this is how you can gain confidence. And when you perform in front of other people, then that gives you, I think, some more confidence than when you perform it alone. I don't want to choose somebody because I don't know if somebody's on duty or they're busy somewhere, but if somebody is free, please let me know so that we can start doing it. Okay, so I think I'm going to be your patient. If you would like to speak first, okay. I'm going to be your patient, and let me find a role play. This is my part. I'll take a screenshot or a picture. Oh, this is the doctor's part. Let me see the patient's part.
Yes.
This is for me. Okay. Let me set the timer first. Have you performed before in the session, or is it your first time?
I performed last time, but it was not that good.
Okay. What do you remember? What score you got last time, roughly?
No, I don't remember.
Okay, so I'll give you 3 minutes. We can read our role play cards this time, and then when you're ready, just let me know.
Okay.
All right, the time starts now. Okay, are you ready?
Okay.
So, will you
Should I
start?
start?
Yes, you can
Okay.
start.
Hi, good afternoon.
Good afternoon.
I am Dr. Farwa. I am the treating doctor for today. May I know about your name and age, please?
Yes, doctor, my name is Ali and I'm 25 years old.
Okay. How I can help you?
Well, doctor, I have, I don't know, what would you call it? I have some problem with my mouth, some ulcers inside and on my tongue, and that is really
Mm-hmm.
bothering me. I can't even
Okay.
speak properly because of it, and I can't eat well. So,
Okay. Do you have any disease already, like diabetes or inflammatory bowel disease?
no, doctor, I don't have any of them.
Are you suffering from fever?
Not really. I'm okay.
Okay. Can I examine your mouth?
Yeah, sure, you can.
Okay. Okay. On examination and the symptoms, based on the symptoms, I believe that you have the aphthous ulcer in your mouth. Do you know what are that?
Uh, I don't really know if this is after ulcer or whatever, but I have been suffering from it for quite a while. I have had it in my childhood, but recently it happened a
Mm-hmm.
lot. Maybe I
Mm-hmm.
work as a salesman, and that is a very high stress job. So I'm not sure if it is
Okay,
related to
okay.
that, or I'm not really sure about it.
Mhm. Okay, let me explain you. Aphthous ulcer are the ulcer which are present in your buccal cavity, oral cavity, and these may have many causes, sometimes due to infection, sometimes due to stress, hormone changes, virus, or allergy. In your case, I think it may be due to the some stress, but let me do advise you some test. Should I recommend you some test for that?
Yeah, but doctor, I would really want something that would really clear it up in maybe 24 hours because as I told you, I
Mm-hmm.
work as a salesperson and I have some important
Okay,
meetings coming up. So I want my ulcers
okay.
to be cleared up in 24 hours.
Okay, I assure you, if you follow my advice on management, they will go as early as possible. First, I will recommend you some blood test for to check for the infection. And should I tell you some management for your ulcer?
Yeah, I would love that. Yeah, doctor.
Okay, you have to rinse your mouth with warm, lukewarm water and add some salt to it. I will prescribe you some medicated mouthwash. You have to use it twice a day. And
Mm.
and I will prescribe you as antiseptic gel that you have applied before sleeping. Here is some painkiller, paracetamol. You can take it to avoid the pain, and you have to take plenty of fluids, avoid spicy food and sour food to avoid irritation. Am I clear so far?
Yeah, doctor, but about this antiseptic gel, I have used it before and it doesn't help me at
Okay.
all. I would want something different from it.
Uh, I assure you, if you follow my advice, as I told you, you will get relief as early as possible. And
Yeah,
yes, yes,
yeah, doctor, the thing is, this antiseptic gel
mm,
you are going to prescribe for me. I have used it
yes.
before, but it's not helping me at all. So if you could prescribe me something else, alternative thing, I'm not sure what it would be, but I would like that.
Okay, I will prescribe you anti-inflammatory tablet. If the pain persists, you can take it, and it will decrease the inflammation as well.
Okay, thank you. That would be great.
Okay, okay. Do you have any more questions?
Uh, no, but if you could tell me like what should I eat normally, so maybe that would be good as
Okay.
well.
Yes, you can modify your lifestyle changes. You can modify your lifestyle. You can take a lot of fluid, try to avoid spicy foods and sour foods, and try to eat less from outside. Am I clear?
Yeah, okay, doctor. I'll try my best to follow your advice.
Okay, hope you feel better soon.
Thank you.
Don't hesitate to call me if you have any concern.
All right, thank you, doctor.
Okay, thank you.
Okay, we still have like 6 seconds, but it's not that bad. How
Okay.
was it for you? Was it easy or difficult?
It was easy. Like last time, I was so confused.
Hmm. Was there any particular task that you think was difficult, or every task was easy for you? You had like quite a lot of tasks, like 7 tasks.
Yes. Explaining to patient is difficult for me. Like I don't know how to explain in very layman language, so he can
Mhm.
understand.
Well, on that part you did well. I mean, you didn't use something really difficult that I could not understand, but I told you about
Yes.
aphthous ulcer that I didn't know what it is. Then you explained that well to
Yes.
me.
Yes.
But the thing is, initially when I told you about my problem that I can't eat or I can't talk well
Yes.
because of the problems, so what you could
Yes.
have done after that, you could have showed empathy towards me. Like you right
Okay.
away
Okay.
asked me if I have diabetes or any other inflammatory bowel disease. So you suddenly
Okay.
jumped into the conclusion, right?
Okay.
Um, if
Okay.
at that point, if you could have asked me, like, if I could tell you more about my lifestyle in general, especially in this
Okay.
condition, you know, this could be caused by stress. I would have
Yes.
told you that I work as a
Hmm.
salesperson, but then I told you that later on, just to give you some information about my background.
Hmm.
So if you could have asked me an open-ended open-ended question at that
Okay.
particular point, then I would have given you more of an insight of my condition, right?
Okay. Okay.
And also empathy after that was really, I mean, it would have really been good if you had showed empathy after that.
Okay. Okay.
So I understand sometimes the tasks are so straightforward that you would just want to ask
Mm.
those questions, but it's always important to, go to the background of the patient as well, especially in
Yes.
this role play card, you don't have much information about the patient's background.
Yes.
Um, and
Hmm.
at the end, especially in the middle, you kind of 2 times said that you have to do this, you have to do that. Maybe
Yes.
sometimes people
Okay.
don't mind it that much. Maybe
Yes.
if you say it such a way that it doesn't sound that rude, but still, I would
Hmm.
suggest you to always use word suggestion, advising
Okay.
something, or recommendation. So
Okay.
just
Okay.
replace that you have to. Instead, you can say,
Okay.
I would suggest you, I would recommend you.
Okay.
So,
Okay.
and the important thing here was most people forget about active listening, but in your
Yes.
case, it was really obvious. So I could hear
Okay.
that really well. And your role play in general, it was really good. You covered all the points. And
Okay. Thank you.
I'll give you one hint, especially when I was asking you a question that if you could prescribe me something else instead of
Yes.
antiseptic gel, that means
Yes.
that something is there on the role play card of the patient that they will ask you that question. So you should have this thing in your mind.
Hmm.
You kind of got confused when I asked you the second time,
Yes.
but then I thought
Yes.
you saw your second last task that you will advise me anti-inflammatory drug instead of
Yes.
antiseptic gel. So always, have this thing in your mind. If patient keep asking you a certain question, there is something in your role play card that you need to tell your patient.
Okay.
All right. So your
Hmm.
introduction was good. Um,
Okay.
Empathy was there in other
Hmm.
tasks, but not right after the first one. So you can just work
Yes.
on that a little bit. And active listening
Yes.
was really obvious. I could hear that clearly. Language, the
Yes.
tone, and everything was fine. Fluency, as you had
Okay.
only 6 seconds left. So I would suggest
Yes.
you just to take that time as well if you can. And
Okay.
towards your closing, closing was also up
Okay.
to the mark. So this role play
Okay.
was a lot better than how it was before.
Okay.
So
Thank you.
for such role plays, I would give you a score based on the criteria that I can just keep in my mind. I would give you like somewhere between 390 to 410 or 420, somewhere in between.
Okay. Okay.
So it's a huge improvement, to be honest.
Yes, thank you.
And okay, so if you have any question, you can ask me.
Not now, but I have to ask if I have question later on. Can I ask in a group?
Yeah, sure, you can. You can ask us in the group.
Okay, thank you.
Okay, what question we will ask in task 1? There is also a question, what to reply for that question when he asked about gel not working. Well, you can, as she said, that she can advise me some other things, anti-inflammatory drug if pain persists, or you can just advise something else if the patient, even if this task was not there, the second last one about anti-inflammatory drug, she could have just advised me something else. If I am not happy with antiseptic gel, she could have just asked me, advise me something else that I would be happy with. And what question we will ask in task 1? In task 1, question the patient to exclude diabetes mellitus and inflammatory bowel disease as underlying condition and herpes simplex as cause fever symptoms. Well, first of all, when patient tell you about their problem and you ask the patient, how can I help you today? The patient will tell you that they have this problem. Then you can say, you can show empathy. And after this, you can say, would it be okay for me to ask you some questions regarding your condition? Patient will say, yes, doctor, you can. Then you can say, do you know if you have diabetes or inflammatory bowel disease, or if you have experienced fever recently? So you can ask this question to your patient like this, and the patient will, if they have, they will say yes. If they don't have, they will say no. And you can say, thank you for answering my question. Would you mind if I examine your mouth? So then you can examine the mouth, and then you can say, based on my examination and the questions I have asked you, so based on those, your answers, you have a condition called aphthous ulcer. So as she asked me, do you know what aphthous ulcers are? Then I replied, so that is how you can ask the questions. Okay, anyone else who would like to perform? Who else would want to perform role play? I think all of the participants are busy. I'm not sure.
Can I try?
Yeah, definitely you can try. Let's find a person for you. If no person is available, then I will be your patient.
Okay, thank you.
I'm a universal patient, so I'll always be there. Okay, so anybody else who would want to perform with her? Okay, that's fine. If this is your first session, you can just listen and get the idea. And also, if the team has given you access to our previous sessions, you can go back to our first session and you will understand all the criteria, what we have discussed. So you can have a better picture. So can we have another person for the doctor, and then you can switch your positions as well. All right, so it seems like no other persons are available. So I'm going to be your patient. Okay, this is my part. I'll take a picture.
Yes, I have taken.
Oh, this is my part. I took a picture, so you can see your part all the time.
Okay.
Okay, so let's read it for 3 minutes and then we can start.
So we can start now. Thank you. Can we start?
Yes, if you're ready, we can start now.
Hi, good morning.
Good morning.
I'm Dr. Samreen, one of the doctor in the surgical unit today. May I confirm your name and age, please?
Yes, doctor, my name is Ali and I'm 45 years old.
What would you like to be addressed?
You can call me Ali.
Ali, I understand that you are waiting for the surgery today. Is that correct?
Yes, doctor, but I'm really anxious about the surgery because I think the lump I have on my back is cancerous. So I was told that it's not, but I'm not sure how would the surgeon know that it's cancerous or not.
Mm-hmm. So I can see you're really worried about it and you are anxious about this. So is it okay? I can ask a few questions, then we can explain your further management.
Yeah, sure, you can.
Okay. So I have reviewed your case notes, and we have seen our medical doctors are also seen this condition before. So it is very unlikely to say anything that this is a cancerous at this point. But after the surgery, we will definitely sending this tissue for the tissue biopsy, and in 2 weeks the results will be there. Am I clear so far?
Yes, doctor, but I was told to attend the clinic as an outpatient in 2 weeks. I wonder what it takes for them to, for this long, like 2 weeks or too much. So I want the result to be out soon.
Mm-hmm. Well, it's our hospital policy. After the biopsy, it takes 2 weeks time to see the results. And once the result is ready, we will definitely love to see you in the clinic. That's why we already booked your appointment for 2 weeks.
And doctor, I also have concern, like, the lump I have is quite big and I'll have a scar on my back. I'm also concerned about that. So how will that go? Will the scar be there or will it go away with time?
Yeah, your concerns are valid. And Ali, after 2 weeks review in the clinic, we will be definitely viewing your scar and its healing. In the meantime, we will be giving you some steady strips, and keeping this area clean and properly dressed can minimize these complications. And your surgeon will be also discussing this further with your. Am I clear so far?
Yes, doctor. And I'm also concerned about one more thing, like, what if, I have this cancer again in the future once it's removed? Like, I don't know if it's cancer at this point, but what if it comes again? So what will happen then?
Let me assure you, Mr. Ali, but these type of lumps usually do not come back in the future. It is really very unlikely. And even this removal of the lump can minimize the chances to have the recurrence again in the future. Do you have
Okay,
any?
but what if the surgeon do not remove it completely? What if some parts are left? So will it grow back?
The team which will be going to take care for you are really supervised, and they are trained enough to do the complete surgery, but it is very unlikely any tissue can remain. But however, in some point, very rarely, if it is still there, then we will be definitely looking to it. But this is too early to say anything about it. Do you have any other concerns?
Um, yeah, but I'm not really sure at the moment if I should go for this surgery. If it's too dangerous for me, I'm not really sure about it.
Well, Ali, most of the people like you who are having this type of lipoma on the back, usually they find it comfortable after the surgery. And as your this tissue is too big in your back, and definitely, how does that work in your daily routines? Can you tell me more?
Sorry, can you repeat the question? I didn't hear you well.
How this tissue on the back, which is called lipoma, is affecting your quality of life?
Well, as I told you, it's quite big. So also the general picture of a person is not really good and you don't feel that much
Right.
confident and also when you sleep. So it's kind of disturbing me.
Right, I can see. Yeah, so after the surgery, this will be gone away, and you will be in the back in normal shape, and you will be happy with your body shape as well, and you avoid these type of complications in the future. Okay,
Okay. All right.
so in the meantime, I will be giving you some more details, and we will be booking this for the time for the surgery. And if you still have any concerns, we will love to explain you.
Okay, doctor. Thank you so much for your help.
You're welcome, and we will be definitely wish you good luck in the future, and have a nice safe surgery. And we will call you after 2 weeks for the review as well as for the biopsy report.
Thank you, doctor.
Right. Thank you.
Okay, it took you exactly 5 minutes time. Well done on that. So, how is it for you? I think it was very easy for you, but I would like to hear from you. How was it for you?
Well, I don't find speaking difficult, but my main concern is that I covered every point. I reassured you, and I was following idea, concern, and expectation, and I was working on that as well to see what the patient thinks and what are their concerns. And same time, I will be explaining all that areas. So besides that, I don't know where it's standing.
You performed really well. I don't really have much to say. Oh, the only thing is, like, at the end, I asked you a few extra questions just to take your time. It may be the speed that you finished it, like, maybe I would say in 3 minutes. You were almost at the last task at that time. So then I had to just ask you a few more questions so that you can have, you can take your time and make it to the 5 minutes. So even if sometimes the patient might not ask you these questions, so you can just give some general advice, like you can say, after the surgery, you can take care of the wound like this, like that, so that you can take your time. So that is the only thing I would like to mention about this role. But the rest of everything was, I think, up to the mark. So And for this role play, I would definitely give you more than 400. I can't really say exactly how much, as it's really difficult to market so quickly, but it's definitely above 400 for a role play like this.
Thank you so much.
Do you have any question?
No, thank you. One thing more, like when I was closing, I was about to say patient information leaflet or any other concerns. Like I don't know, in this, like I should say at that point, or I just say I wish you get well soon and all those.
Well, it's always good to give information leaflet. You're offering extra help, so that's positive. So that's good. You did well on that.
Okay, thank you.
Yeah. So yeah, I think this was one of the best role plays in our session so far for this batch. So if anybody would like to learn, they can just go back to the recording and learn from this one. Anyways, do we have any other persons who would like to do it? So if not, if everybody is busy, so then we will end the session for now. And I have also shared the book about these role plays and the collection of different sentences that you can use in different situations. If you open that, you'll find them. And if you have any questions, you can ask us in the group. Any suggestions, recommendations for us, you can always give that to us in the group. And the next session will be our last session. So I would want you guys to participate in it as much as possible so that we can clear your queries if you have any questions or any queries so that we can clear them. And I think it's a goodbye for now.
Well, I'm struggling in OET with my writing task, and that is a nightmare for me still. So I just need some suggestion how I can improve my writing.
Well, I think your writing mentor would be the best person to comment on this, but I can just, you just need to understand, like sometimes you will write to different people, sometimes to doctors, sometimes to nurses, or sometimes to managers. So you need to know what information are necessary for that person. Like if you want to write to a doctor, then you will be talking more from the medical point of view. But if you're writing to a manager, then you might not go that much for the medical point of view, but depending on the recipient. And also, it's really important for you to understand how much that person already knows about the patient. If you're referring the patient back to the GP, then you don't need to include some of the information like medical history, the background of the patient, because that person already knows about it. And how will you simplify the case notes into your own words? So conversion is really important. At this point, I can just give you this suggestion, but you can ask this question to your writing mentor, who would be the best person who can answer you.
Okay, thank you.
All right, thank you guys so much. And if you guys have any question regarding speaking or in general, you can ask us in the group, and other mentors are also there to help you. And it's a goodbye for now.